Hi, today I'm going to talk about my med map. I have chosen 6 medications. Let me give you a brief description about my patient. My patient is a 70-year-old male with a primary diagnosis of non-alcoholic steatohepatitis, also known as non-alcoholic fatty liver. He arrived at the hospital with complaints of vomiting coffee grounds and dark blood. And he was found that he then was diagnosed with esophageal varices with bleed. They also found an spontaneous bacterial peritonitis with a GI hemorrhage. So a little bit of more of his history. He currently has hyperlipidemia. He has benign prostatic hyperplasia. He has hypertension. He has thrombocytopenia. He had also kidney stones previously. And let me go ahead and start with the first medication, Spironolactone, that is used and managed to any edema associated with heart failure. And he has also, for him, it's because of his cirrhosis. It is also for his hypertension. Some of the body that it can be affected will be the CNS. That's one of the main ones, with giving him dizziness, headache, sedation, clumsiness. Another one is a fluid and electrolyte imbalance. It can cause hyperkalemia and hyponatremia, and hyperchloremic and metabolic acidosis. And it can also have hematocologically problems with thrombocytopenia, which that was one of my main concerns when I saw this medication, because he currently has thrombocytopenia as one of his diagnoses. And now I'm going to be talking about furosemide, his second diuretic. Furosemide is also for hepatic impairment, and also for hypertension and for any edema, for heart failure. Some of the body parts that it can be affected will be also the CNS, any blurred visions, any dizziness, vertigo, headaches, and it can also cause any fluid and electrical imbalances. It can cause dehydration. It can cause hypocalcemia, hypochloremia, hypokalemia, hypomagnesemia. So there's a lot going on from fluids and electrolytes. It can cause his GI diarrhea, and it can cause dry mouth. It can also cause an increase in his BUN, which in his labs, what I was checking, he actually has an elevated BUN as a 34. So that was another of my concerns regarding this medication. And the hematological problems that is being related to is that it also causes thrombocytopenia, and he's currently diagnosed. So as of right now, spironolactone and furosemide, they're definitely affecting hematologically his body, related his hematologically, because he also has in his labs, he had a low in white blood cells, red blood cells, hemoglobin, and hematocrit. Now I'm going to be talking about Finasteride, and this one is used for his benign prostatic hyperplasia that he currently has, and this one is affecting his endocrine system. It can cause gynecomastia, and it can also cause prostate cancer. Those are the only two, but that's the only two side effects that can cause. Now I'm going to be talking about Simvastatin. Simvastatin it's managed primarily for hypercholesterolemia and mixed dyslipidemias, prevention for a myocardial infarction, and he currently has hyperlipidemia, so most likely we're protecting that heart in case that plaque doesn't go into his arteries. Some of the side effects that we can see will be also CNS depression. You can see any dizziness, any headache, any weakness. It can cause in his gastrointestinals any abdominal cramps. It can cause constipation, diarrhea. So that's another concern that I have, that he can have diarrhea with this medication, because he's currently having a GI hemorrhage. It also can affect his erectile dysfunction too. The second medication is this one. Pantoprazole. This one, it's for erosive esophagitis, any association with GERD too, according to that, causing that erosive, and for maintenance of that healing for that erosive esophagitis. Any on-label use for this medication is an adjuvant treatment for any duodenal ulcers associated with Helicobacter pylori. What we can see this medication affecting is also the CNS, causing any headaches. It can cause also fluid and electrolyte imbalances, causing hypomagnesemia. It can cause also diarrhea, C. diff, and it can also cause hematologic problems with vitamin B12 deficiencies, and it can cause bone fractures. My last drug is Ciprofloxacin, and it can cause also, this is used for any abdominal infections, or any skin infections, any bone infection, any joint infections, or any urinary tract infection, or any lower respiratory infections that the patient can have. He currently has bacterial in his peritonitis area. Some of the side effects are the headache that can cause. It can also cause fluid and electrolyte imbalances with hypomagnesemia. It can cause diarrhea, C. diff. It can cause also hematologic problems with vitamin B12 deficiency and bone fractures. So all of these medications, one of the major risks that I'm seeing is that they all cause, the majority of them, the 5 of them cause the CNS problem, which he's at risk for falls. And ciprofloxacin can cause bone fractures, so he's definitely needs to be put in a precaution for falls. And for fluid and electrical imbalances, there's like 5 or 4 medications that they are causing all of this fluid and electrolyte imbalance, so he can definitely have any cardiac problems. And the other ones that I'm seeing is that all of the 6 medications, they all cause problems in the endocrine system. And he is also, this two that we talk about, the Spironolactone and the Furosemide, they're both causing thrombocytopenia, which he's currently diagnosed with. Thank you.